Good evening. Welcome to Fox Valley Lutheran High School. Welcome to our FVL Schools Community Parents Night, Teenage Suicide, Warning Signs, and Prevention. My name is Jason Gibson. I serve as the principal of Trinity Lutheran School in Neenah, and I also serve as the president of FVL Schools, a partnership of child care centers and schools from preschool through 12th grade throughout the Valley area and beyond, from Oshkosh to Green Bay, from Wyowega to Brillion. I'd like to thank our host this evening, Fox Valley Lutheran High School, for allowing us to use their beautiful facility here. And I'd also like to thank the sponsors who've made our evening possible, Chris Schumacher of Thrivent Financial and the Family Radio. Suicide is a growing problem among our young people today, and it's a problem that affects young people regardless of race, socioeconomic status, or religion. Teens are receiving confusing messages about suicide and self-harm from the world around them. Tonight's event will raise parents' awareness and help them support their children and teens. Our speaker tonight is Elizabeth Robinson. Liz spent 5 years in a local psychiatric hospital working in the child adolescent program, providing individual, group, and family therapy to children and adolescents with a focus on depression, anxiety, suicidal ideation, and self-harm. Liz joined Christian Family Solutions in 2013 and is a licensed professional counselor. Please join me in welcoming Liz Robinson.
Am I on? Okay. Hi guys, thanks for coming out tonight. It's kind of bright up here, so if I'm like squinting at you, I'm not mad at you, I'm just trying to see you. This is a really hard topic, and it's a really important one. And so I'm just really glad that you're all here so that we can be having these discussions. I spent the day today here with the high school students at Fox Valley Lutheran talking about a lot of these same things that I'm going to share with you guys tonight. I'm just sort of curious, how many of you that are here tonight have a student that goes here at this school? Oh, so many of you. That's great. So you will be getting a lot of the same information that they heard today, which will hopefully help be able to have some of these conversations. We also have on our table outside is a handout that has some information about the Netflix series 13 Reasons Why, and some discussion questions that you can use to start some of those discussions at home if you would choose to. So this is a tough topic, and we're not going to back away from the fact that it's tough. So we're going to start out with a video.
Dear Mum, I wrote this letter to tell you how much I love you, and to tell you I'm sorry. I know I've been a pain at the best of times, and I really appreciate all the years you put up with me. Thank you for always holding me when I was having a bad day. I love you. I love you to the moon and back. Thank you for all the memories and all the support. Thank you for giving me the best 17 years of my life. I will never forget the times we had together. I think you know what this is. And you won't understand, and I'm sorry. I'm so sorry. You have to believe me. There was nothing you could have done, and this was 100% my decision. You are the most beautiful mum, and I never want you to think otherwise. You see, I've been fighting this war with myself for the past 5 years, and I've been on the losing side. And now I've officially waved the white flag. And I'm sorry that this will have affected you so much. But you have to believe this is not your fault. This is not your fault. This is in no way your fault. And I know you are sad, and I know you are crying, and I know that you hate me for leaving you, and I can understand that. What I've done is so selfish, and I will admit it, it's selfish. Suicide is 100% selfish because you do it for no one else but yourself. I didn't do this for anyone but myself. But please, take this from this letter. I want you to be happy. I want you to take life by the horns and live it to the fullest. I was never meant to live, and as soon as you can accept that, the happier you will become. I want you to live how you want to live. Hold your head up high and say to yourself, I can do this, and remind yourself that I love you more than anything or anyone. Wake up to the day and hear my voice. I want you to hear me saying I love you because I really do. And you did everything you could. You did everything you could and so much more. And I'm sorry that I've hurt you, and I'm sorry that we've hurt each other. And I've always thought of you, and I will always think of you. To me, you haven't just been a mum. You've been a best friend, a sister, a psychologist, a taxi driver, a doctor, and a chef. Thank you. Thank you for dealing with the bullshit, dealing with my personality. You are a hero. Who needs Batman and Superman when you exist? I know it's going to be tough, but I know you can get through this. Because you are the strongest woman that there has ever been on this earth. I want you to remember that, even though I'm not here anymore. It doesn't mean you aren't in my heart, and I will always be with you. When you think I'm there with you, I am. I'll always be in your heart. I will always be in there. I'm always next to you. Thank you for making me the happiest I could be. I love you, Mum. I really do. I hope one day you'll be able to forgive me. Your little ray of sunshine.
No.
Oh my God, Mum! Mum, you're right!
Oh my God! Oh my God!
Mum!
Oh, my beautiful girl, I love you. I love you. I am always here for you. I was so scared. Thank you so much for coming home.
I don't know, I just couldn't do it anymore. I don't know.
You're not alone, okay? I am always here for you. You should come, you need to come to me, okay? I love you.
I love you too, Mum.
So I know that was not an easy video to watch, especially because a lot of you are parents of teenagers, but I think it's important because it's an emotional video. It helps you to see what this experience would be like. And I know that we want to think, not my child, not at my child's school, not in my community, but statistically speaking, that's just not really true. So suicide is the third most common cause of death for teens aged 15 to 19, and some statistics, depending on how you look at age and which study, actually say it's the second most common cause. In 2010, 4,600 people between the ages of 15 and 24 killed themselves. And I know that's a fairly old number, but I guarantee that number has not gone down. If anything, I would guess that it's gone up. 4,600 of our young people killed themselves that year. According to a study the CDC did in 2014, which they haven't released a new one since that I could find, 17.7% of high school students had seriously considered suicide. That's almost 20%, almost 1 in 5. 14.6% had planned to attempt suicide. So this is not just, I'm thinking that I don't want to be alive. This is, I've actually figured out how I would do it. And I'm planning on following through on that plan. And 8.6% had attempted to kill themselves. That's almost 10% of our young people that had attempted suicide. That's a huge number, you guys. And that's why we're here and why we're talking about this. Because it's real and it's happening in our community, in our schools, and with your babies. So this next slide, maybe, there we go. These are faces of kids, teens, that have committed suicide. They're all ones that were publicly found. They're none of my patients. But these are kids that if you look at them, it looks like things are probably okay. But these are children who lost the fight and died. So one of the things that's been happening recently with suicide in the news is Facebook Live suicides. So this was more of a thing this spring. I haven't heard about it so much in the last few months, but it still bears mentioning, where at least 3 teenage girls and at least 2 adult men that I've been able to find have killed themselves while streaming their suicides on Facebook Live. So the world, or parts of the world, watched these people die. And Facebook has taken them down, but a lot of them you can still find on YouTube. Once something's on the internet, it's there forever, and it'll never go away. And if I can find it, your kids can find it. And they can see somebody kill themselves. And that's terrifying for a lot of reasons. One, because we don't want our children watching things like that and being exposed to that. And 2, because once you see someone else do something, it makes it more okay to do it yourself. So this isn't something that I expect to go away. Now, if not Facebook Live, some other live streaming platform, I think we will see more of this. The other thing connected to suicide that's been sort of in the news and in the media this last few months is the Netflix series 13 Reasons Why. Out of curiosity, raise your hand if you've watched this. Not very many of you. Almost every teenager I know has. Now here today, there were a decent number of kids that said they hadn't seen it, but that's uncommon. Pretty much every teenager that's come through my office has watched it. If your children are watching it, I recommend you watch it. Not because it's uplifting and a joy to watch, but because it's raw and it's intense and it's a lot for our teenagers to deal with. And I think you need to know what it is that they're seeing. So things you should know about it. 13 Reasons Why is the story of a teenage girl named Hannah Baker who chose to end her life at the end of the series. And what it's showing is she made 13 cassette tapes, each one targeted to a specific person that she believes contributed to her decision to kill herself, and sort of explaining how they affected her and how they negatively impacted her. What you need to know about this show is that it very graphically depicts rape and suicide. You see 2 teenage girls get raped, and they don't shy away from showing you that and showing you the pain of that. You watch Hannah kill herself in a very graphic suicide scene. And I work with kids who struggle with this stuff every day, and it was a lot for me to watch. And so for our teenagers to be watching this, it's not something that you can unsee. It also contains themes of homosexuality, drug use, bullying. And some of those are things that your students are going to encounter in high school and going to have to deal with. But my biggest problem with that is that there's no hope shown. It shows all the bad, all the yucky, horrible things that can happen in high school, but not the good, not the hope, not the support, not the fact that it can get better and that there's ways to reach out. The adults in the series are either sort of oblivious or actively unhelpful. When she finally reaches out to the guidance counselor, he pretty much tells her to get over it. So that's sending the message to our teenagers that the adults don't care, or they're not going to help even if you reach out. And that's scary. Throughout the whole series, there's the question that keeps being asked, who killed Hannah Baker? And everybody is questioning, was it me? Did I kill Hannah Baker? Did that person kill Hannah Baker? Hannah Baker killed Hannah Baker. Hannah Baker had some really awful experiences, and I think was struggling with depression and had a lot going on. But at the end of the day, it was Hannah's decision to die. And that's a message that's not clearly communicated in the series. And it's easy for our kids who maybe aren't struggling themselves, but who know somebody who's struggling, to take on that responsibility of feeling like they have to keep their friends alive. Or if something happens and one of their friends does commit suicide, that somehow it was their fault. And that's not a message that we want our children to be hearing. I should also tell you, if as we're going through you have a question, you can raise your hand or stand up and jump around and shout at me. I'm happy to be interrupted if something's not clear or you need more information about something. All right? So why suicide? Why do people choose to take this really final step and end their life? So all the reasons on this slide are things that patients have actually said to me in my office. This first one is one of the most common. I just want it to stop hurting. Sometimes it feels like things hurt so bad and there's no way out and you don't know what to do about it and you just feel like you can't deal with it hurting any longer. When you're in that place, suicide is an option. Suicide will make the pain you're feeling right now stop. It would be better for the people I love if I were dead. If you don't love yourself, if you feel like you're a burden to your family, if you feel like you just keep making mistake after mistake and they keep having to help you and clean up your messes, and you don't see that they're getting something out of it, maybe it does feel like they would be better if you were dead. They wouldn't have to deal with you anymore and with your problems. They might miss you for a little while and then they'd get over it and their life would be better. Or, no one would miss me. When we're depressed, we often isolate. We pull back from the relationships in our life because we're struggling and it's too hard to maintain them, or we're afraid to let somebody see. So part of what that does then is it makes you more alone, and it makes it feel like no one would miss you. Nobody talks to me, nobody knows, nobody would really care if I was gone. Maybe then my father would realize what he had lost. So for this patient, Dad had pretty much just left. He'd checked out of the family. He wasn't in the child's life anymore. And for that person, it felt like maybe if I take this really drastic step and I end my life, my dad will realize what he did. He realized what he did to me and what he did to our family and what he missed out on by leaving us. I'm a bad person and I deserve to be punished. If you feel like all you do is mess up and make everybody else's life harder, maybe you do feel like you need a punishment. Maybe you do feel like you've ruined enough things that you deserve to die, that you don't deserve to live anymore. It's not worth it. You're not worth it. If I were dead, I would be with my grandfather. When we lose somebody who's close to us, especially if that person is a big part of our support system, a part of where we get our comfort and our own self-worth, and now they're gone and they're in heaven, heaven's a pretty good place. Being here and missing them hurts. Maybe it would be better just to kill yourself. Maybe it would feel better to be there and not have to deal with this here. The voice told me to kill myself, or the voice told me to kill someone else. Sometimes when kids are really struggling with depression, they end up having thoughts or hearing things or seeing things that aren't really there as a part of that depression. And those things can be really disturbing and can tell them to do things to hurt themselves or to hurt other people. So actually for this child, he felt like if he killed himself, he wouldn't hurt anyone else. And that was his logic for why he felt like suicide was the answer. These are obviously not an exhaustive list of reasons that people choose suicide, but part of what I wanted you to see with this is there isn't one reason. There isn't one cookie-cutter answer that explains why someone would decide to end their life. It's different for different people in different situations, and we can't just put a Band-Aid on it and say, well, this is the one reason that people do that, so we'll just fix that and then everybody will be okay. Unfortunately, it's just not that simple. So we are going to talk next about some risk factors or stressors that might increase the likelihood that someone would be struggling with suicide or suicidal thoughts. So having a psychological diagnosis, I've got a whole bunch of them here. I'm not necessarily going to run through all of them. But the mood disorders, things that affect our mood, depression, anxiety, bipolar, those sorts of things. If we're feeling overwhelmed and depressed and sad and like we can't handle it, or like we're so anxious we just can't function, that makes it more likely for suicide to feel like an option. PTSD, if you've had trauma, trauma shakes up your whole world. It makes everything different. It makes things that were safe before not be safe now. It makes you question yourself and the people around you. And if you don't feel safe, especially if you don't feel safe anywhere, that's a really hard and hopeless way to feel. ADHD. A lot of times people with ADHD are impulsive, right? They don't always think through their decisions. If you are struggling and the idea comes in your head that maybe I should kill myself, and your MO is to act impulsively, it increases the risk that you're actually going to act on that thought. Drug and alcohol abuse. This is another one that kind of goes along with this next slide here. So a lot of times we use substances to manage our symptoms. We feel in pain, we feel overwhelmed, we feel like we can't cope, so we drink, or we get high, or we use drugs. So if somebody is using, it's very likely that there's something else going on. Additionally, if you are drunk or high and you're feeling depressed, we know that people don't always make the best decisions when they're intoxicated. So if they were struggling anyway, and now they're intoxicated and not making good decisions, it makes it much easier for them to go ahead and act on those suicidal thoughts. Isolation and perception of aloneness. So we talked about this a little bit before, but if I feel alone, if I feel like nobody understands me, nobody's listening, nobody has my back, where do you go for help then? How do you reach out and ask for help? It's really hard. Bullying. So all of those teens that I showed you a couple slides back where we saw their faces, every one of them, bullying was considered to be one of the main triggers for their suicide. Bullying is real. It happens even in our Christian schools. Today when I was presenting to the teens, I asked them to raise their hand if they felt like they had been bullied or they knew someone who had been bullied. In every age group, almost every single teenager raised their hand. That's just so sad that we're still treating each other that way. And bullying can have such a big effect on someone's sense of self and of their worth and their perception of whether they should be alive or not. And I've had patients who were bullied to the point where people were telling them to kill themselves, saying, "You're not worth it, you should go die, nobody cares, no one would miss you if you were dead." It's real and it happens even in our Christian schools. Acculturation issues, so sort of with the isolation and perception of aloneness, feeling like you don't fit in. If you don't fit in, nobody's going to miss you. It won't matter as much if you're gone, and you don't have anyone to turn to. Academic performance anxiety. None of our kids ever get anxious about tests or how they're doing with their grades, right? Kids that are really struggling with this, that are putting really a lot of pressure on themselves to be perfect, well, they're not going to be perfect. That's not reality. They can't be. But if they're trying to hold themselves to that standard, or they feel like maybe you're holding them to that standard, and they can never, ever meet it, that's a hopeless place to be. Family discord. Home is supposed to be a safe place. It's supposed to be the place we come back from when we've been out in the world where things are crazy and chaotic and hard, and we come home and it's safe and we're loved and we're cared for and we can just sort of relax and be okay and recharge. That's not what home is for everyone. For some people, home isn't safe. And there's yelling and screaming and abuse or substance use or maybe just not enough food to eat. But not having that safe place where there's adults who support you can increase your child's risk, or the risk of one of your child's friends. We talked about impulsivity a little bit. Access to firearms or other means of harm. So obviously there's things people can use to hurt themselves in anybody's home. You have sharp objects, you have cleaning supplies, you have things that someone could use to hang themselves. But if they're struggling already and they still have access to those things, the risk of them using those objects increases. Loss of a loved object through death or absence. So going back to that idea of I want to be with my grandpa. When we lose someone or when somebody leaves us and we feel alone, sometimes suicide feels like the way out. The next two sort of go together. Lack of a future perspective or hopelessness. If you can't see things getting better someday, if it hurts really bad right now, but you really think, okay, this is hard, but in a couple years I will have gotten through this, I'll maybe be out of high school and things will be different in my life, I just got to get through it, it feels more manageable. But if you believe that how I feel right now today is how I'm going to feel every minute of every day for the rest of my life, and how I feel right now today hurts so much that I don't know how I can do that, that hopelessness, that lack of ability to see a positive future, it makes sense that people would want to give up. Having a friend or a family member who has attempted or completed suicide increases the risk that your child will do so as well. Having a trauma or abuse history can be a risk factor. Poor self-concept. If I don't like myself, if I don't feel like I'm worth something, if I don't feel like I have value and I offer something to the world, what's the point of me being alive? Not helping anybody. I don't matter to anybody. Maybe I'm even making things harder. Self-harm. So self-harm is complicated because self-harm and suicide are two different things. Someone can be self-harming and not be suicidal. Someone can be suicidal and not engaging in self-harm. So every time someone cuts is not a suicide attempt. However, you can have someone who cuts who also attempts suicide. And if you're struggling enough to engage in self-harm, you've got some stuff going on. Things are hard. And if things are that hard, the risk is higher that you would get to a place where you would consider or attempt suicide. Does that make sense? Because I feel like this is something that gets muddy for people sometimes. Do we have questions about the difference between the two? Okay. Disappointment that past suicide attempts did not work. When I have patients who come into my office who've attempted in the past, I ask them, how do you feel about the fact that that didn't work? And sometimes they say, I'm so glad I didn't die. I know I'm still struggling and I know it's hard, but at least now I still have a chance. And sometimes they say, I wish it would have worked. Next time I'll do a better job. I had a girl in my office yesterday beg me to let her kill herself. Just because they've attempted once doesn't mean that they won't try again, and next time they might get it right. So now we're going to talk about some of the warning signs of suicide. Obviously, none of these are like, oh, if this is happening, then absolutely they're thinking that, they're feeling this way. But it just kind of gives you an idea of some of the things to be looking for in your kids. Changes in sleeping patterns. When we're depressed, often our sleeping patterns change. So they can change a couple different ways. One way they can change is by your child being so tired all the time, and all they want to do is sleep. So they come home, they go to bed, they sleep for 12, 14 hours, they get up, they drag themselves through school, they come home and they go back to bed. And that's just what they're doing, is just sleeping all the time. The other way it can go is they can't sleep. Maybe they're really tired, but they go to bed and they just cannot fall asleep because they lay down and their mind starts going, and now they're thinking about all the things that they did today and every mistake that they made. And they're thinking about everything they have to do tomorrow, and that test coming up in a week, and the test coming up in a month, and the dance that's coming up this weekend, and what am I going to wear, and who am I going to go with, and maybe nobody actually likes me, and nobody will want to go with me, and maybe nobody wants to be my friend, and maybe that's because I'm a horrible human being, and I'm not worth loving, and maybe I should kill myself. And the thoughts just spiral, and they lay there and think over and over about these things, and they can't turn it off. Irritability. So teenagers can be irritable. We know this, right? This isn't like the normal, like just kind of a grumpy teenager. And this isn't, they've got a big test coming up and they're stressed out about this specific trigger. This is more of a change in overall mood. If your child has been a reasonably content, pleasant person to be around, And you're seeing a change where they just can't handle stuff. And little things set them off, and they just can't deal with it. And this is happening over a little bit of a period of time. This is a warning sign that something's going on that they're struggling with. And it might not be suicide, it might be something else, but it's still something to be aware of and kind of check in on. Poor concentration. So if half of my mind is always thinking all of those thoughts about how worthless I am and how I'm such a failure and I can't do anything right, and what is that person thinking, and are they judging me, and maybe I shouldn't even be alive, and maybe I should kill myself, and how can I kill myself? And if that's what's going on with part of your mind, and then I ask you to take a math test, you're going to have a hard time concentrating on that math test, because you've only got like half your mind maybe to do it with, and the other half is such a mess that it's hard to stay away from those thoughts. So if you have a student who normally can concentrate reasonably well, and we know some of our kids have ADHD or other things that concentration's never been a beautiful thing for them, but if it's someone who hasn't struggled with that so much in the past, and now all of a sudden they just can't seem to concentrate, it's a warning sign. That hopelessness and helplessness we've sort of already talked about, but that idea that it's awful, it's horrible right now, and it's never going to change, and there's nothing I can do about it, and maybe there's not even something that anybody else could do about it. Even if I told somebody, they can't fix this, they can't help me. Depression. If your child is seeming more depressed, if they're sad, they're more tearful, they're isolating, they're pulling back from their social relationships, maybe the things that they used to like to do and they used to really get joy out of, they're not doing those so much anymore. That's a warning sign. Something's going on. If they're worried about things, they're panicking about things that didn't used to be a big deal, but they get so anxious about it and they're worrying about things all the time. Or maybe there's a specific thing that they're super anxious about right now, all of a sudden now, like they used to be fine, but now they can't be in a crowd of people because it makes them panic. Something's going on. Not necessarily suicide, but something. Preoccupation with the past and their failures. If all your child can think about and talk about is how they didn't do well enough. You know, I got a 95 on that test, but everybody else got a 98. What's wrong with me that I didn't get that higher score? Or I was mean to this person today, even maybe by accident, and I hurt their feelings. If they're stuck thinking about all of the ways that they're not good enough, and that's what they're expressing to you, that's a warning sign. Maybe? Okay. Vague statements that the world would be better without them. So these aren't necessarily them coming to you and saying like, hey, I don't want to be alive. This is less direct. This is things like, maybe you guys would just all be better off without me. Maybe I never should have been born. Maybe you should just kick me out of the family. I shouldn't be here anymore. Things like that. Suddenly appearing very happy or very cheerful. And this is one that's sort of counterintuitive because it seems like if they've been really struggling and all of a sudden they look good, that's good, right? They must be all better. But probably not that simple. People don't usually just flip a switch and go from really struggling to being all better. What it could be is that they've decided to kill themselves. So sometimes when we've been struggling and we've been really struggling and we're hopeless and it's hard and we don't know how to deal with it, and we decide, you know what, I'm done. I'm not doing this anymore, I'm killing myself. Now there's an end in sight. Now we know that this isn't forever because next Tuesday is it. I only have to survive another 5 days and then I'm going to be dead. And that sense of a way out can actually brighten their mood and make them seem like they're better when in fact they're actually worse. The next one up here is giving away possessions. So sort of like we might make a will and decide what happens to our things when we die. If somebody is suicidal and they've really decided that they're going to do it, they might want to make sure that people that they care about get certain things. So if your child starts giving away things that mean something to them, it's important to try to understand why. And maybe there's a good reason. Maybe this is something that they think is going to help their friend and it's worth letting it go to help their friend, and that's fine. But especially if they're giving away things to multiple people. What's going on? Why are you doing that right now? And going along with that, activities that feel like saying goodbye. So all of a sudden they're telling you how much you mean to them and how much They appreciate you taking care of them and loving them, and they know they've been a hard child to deal with, and they really appreciate your love. And that's not kind of the norm for you. Or maybe they want to go see grandma, they haven't seen grandma in a couple months, and they're really insistent, like, no, you have to take me to see grandma, it has to be this weekend, it can't be next weekend, it has to be right now. It might be because they know they won't be alive next weekend, and they want to make sure they say goodbye to grandma. And then that last one up there, past suicide attempts. So once someone has attempted once, the likelihood of them attempting again increases. That's not necessarily true for the rest of their life. If we can get them some treatment, we can help them work through things, they can come out the other side and be very safe. But in the moment, in the crisis times, if they've done it once, they're more likely to do it again. So, now that you know all that really fun information, what do you do about it? And I think maybe that's why a lot of you are here, is to figure out, okay, so we recognize that this is a problem, but we don't know what to do if it happens. If this comes up and we're worried about our child, how should we handle that? So, we're going to do a little role play, and my friend Ashley is going to come up here, and she is going to be my teenage daughter, and I'm going to be her mom, and I didn't think through the second microphone thing. Could we turn this one on, maybe? Ooh, it's on. Okay, so the scenario is that I just saw something in some of her social media that I'm concerned about, and I want to have a conversation with her about that. All right? You ready, Ashley? Okay. Hey, Ashley, how you doing?
I'm fine.
Okay. So I was looking at your Instagram, and you had some stuff on there that made me a little bit nervous.
Okay.
You had some song lyrics that talked about just wanting to give up and feeling like you couldn't do it anymore.
It's just a post.
Well, right, but that wasn't the only one. There were some other ones that seemed like maybe you were having kind of a hard time.
It's fine. I don't want to talk about this. It's fine. Can we be done?
Yeah, no. I know that this is hard to talk about, and maybe I'm not the easiest person to talk to about it, but I really love you, and I want to help. What's going on?
I don't know. Stuff's just hard.
Yeah, it is hard to be a teenager.
Yeah.
Yeah. Can you tell me what kind of things you're struggling with right now?
I don't know. Just, like friends, school, just general stuff.
Okay. From your posts, it sounded like maybe sometimes you feel like it's just too much.
Yeah, like I said, it's hard. It's a lot.
Yeah.
I don't really know what to do with it.
Okay. Do you ever have thoughts about not wanting to be alive?
Maybe.
Okay. I feel like maybe might mean yes. And if that's true, we're not going to be mad at you about this. We just want to help figure out what we do to help you be okay. So was maybe yes?
I don't know. It just feels like I'm just in the way.
Like in the way for Dad and I?
Just everyone. I feel like you guys are always having to deal with me, and I'm always just a mess. So just be easier to just not have to do this anymore, and for you guys to not have to do this anymore.
Well, you might feel like a mess, but you're my mess. And I love you. And I don't care if you're a mess every day for the rest of your life. I'm still going to love you, and I'm still going to want to help. Do you ever think about actually killing yourself?
Yeah.
Okay. Have you thought about how?
Yeah.
Can you tell me?
Are you gonna be mad?
No. I'm not going to be mad, and I'm not going to yell, and I'm not going to freak out.
Okay. Yeah, I mean, I don't know. I've thought about I I don't know, just like cutting or, I don't know, just like taking some pills and just fading away.
Okay. Why haven't you?
I mean, I feel like you guys would be better, but I don't want to like hurt you either.
Do you think that now that I know, you'd be able to talk to me about it if you were struggling?
Maybe.
Okay. I'll take maybe over no. Is there someone else that would be easier to talk to? Maybe an aunt or grandma or somebody at school?
My coach?
Your coach? Okay.
Yeah.
Does she know any of this now?
No.
Okay. Do you think we could tell her enough that she wouldn't be surprised if she got a call from you that you were struggling?
I suppose.
Okay. Do you want to talk to her together, or do you want me just to talk to her?
I don't know, maybe together. It might be kind of weird if you just like call her.
Okay. Good. Is there anything else I don't know that's going on right now, honey?
Like what?
Like, what about self-harm?
I don't want you to like be mad or freak out.
I haven't freaked out yet. I feel like I'm doing okay.
Yeah.
Is that a yes too?
Yeah.
Okay. Things feel really hard right now, don't they, honey?
Yeah. It's just a lot, and I don't know what to do with it all.
Okay. I think that I want to help, but I know that I don't have all the answers. What do you think about us finding someone for you to talk to, like a counselor, a therapist?
It's not for like crazy people.
No, I think it's for people who are struggling and are brave enough to let somebody help them. I don't think you're crazy. Okay. So I'll work on figuring that out. Between now and then, what are things you can do to kind of help yourself when you're having a hard time?
I mean, I like running.
Okay. Do you feel like when you're struggling, you're safe to go for a run?
I feel like most times, yeah.
Okay. If you're not, you tell us? Or don't go, or invite one of us to go with you?
Sure.
Okay. All right. And if it gets really bad, you'll come to Dad or I or your coach?
Yeah.
Okay. We're going to figure this out, okay? Thank you for telling me. I'm really proud of you. Okay. Thanks, Ashley. So we're going to talk through sort of what I did there. And I do this all day, every day, so I know all the right questions to ask. You guys aren't going to necessarily remember all the right questions in the moment. But there's some kind of key things that if this comes up for your child, or if one of your child's friends comes to you, because a lot of my kids, it's hard to talk to mom and dad, but they might tell a friend's parent. So it's very possible that your daughter's best friend might go to you instead of her own mom. And if that happens, I want you to know what to do. So this first one might be the hardest. Stay calm. This is hard. This is scary. It's your baby and you love them and you want them to be okay. But if you overreact, or if you react in a big way, you start sobbing or yelling or seem angry or disappointed, that's going to shut that conversation down. They're not going to tell you any more in that moment, and probably not again. You've got to stay calm. So that means taking a deep breath. That means saying a prayer, asking God to help you be calm and get through this conversation, and then you can go cry later if you need to. Or if you know you saw something and you're going to approach your child, but it's not that they came to you in the moment, take a little bit of time and calm yourself down before you go reach out to that child. Ask them about it openly. You notice I specifically asked her if she has times where she doesn't want to be alive, if she's actually thought about killing herself, if she's thought about how she would do it. Those are important questions to ask, And asking them is not going to make your child want to kill themselves. It's okay to be direct and to say the word suicide, to say the word die, to say kill yourself. Those are okay things to say. And maybe they're not to a point where they've thought about how to kill themselves, but they just don't want to be alive. These are the things that it's important to ask your child, even though it's hard, and even though part of you is a little scared to ask it because you don't know that you want to hear the answer. It's important. And it's hard. It's hard to come to somebody and tell them this. If I'm a teenager and I'm feeling this way, for me to walk up to my mom and dad and be like, hey, so by the way, I might not be alive tomorrow. That's a really hard conversation to begin. So if you're worried and you reach out to them, you've just opened that door and given them the opportunity to talk to you. And they might not have otherwise. Don't take a negative response at face value. If you're worried about your child, if you think that they're struggling, if something just feels off, and you ask them if they're okay, you ask if they're thinking about some of these things, and they say no. That does not mean badger them until they say yes. But it does mean I'm getting ahead of myself. It does mean that if your gut says something's wrong, listen to your gut and be watchful. And maybe ask again at another time. Give them a chance to sort of think about telling you. Let them see that you're being calm about it, that you're not overreacting, and then check in again. Validate and empathize with their feelings. I think a lot of times teenagers feel like the adults in their lives don't actually hear them. We just talk to them or at them, and we don't hear what they're saying or what they're feeling. They need you to listen. They need you to hear what they're feeling and what they're saying, and understand that even if it's not how you would feel in that situation, that doesn't matter. What matters is how they feel right now, and right now they hurt. Whether you understand why they hurt so much or not. Explain to them who you're going to tell about this and why. This is a really deeply personal topic. It's not something that anyone wants shared with all of the people in their world. So if you are going to tell someone, if you're going to tell someone at school so that they can help keep your child safe, if you're going to tell dad or the other parent, if you're going to tell, their coach or somebody else in their lives, they deserve to know that, and they deserve to know why you're going to tell that person. They need to understand that you're not bad-mouthing them or gossiping them or trying to spread their business, but that you're doing it because you believe that this person can help them stay safe. Offer support or to connect them with someone they feel comfortable opening up to. So you notice Ashley wasn't sure that she could come to me. That's common. It's hard to come to our parents. We worry about disappointing them. We worry about hurting them. We worry about letting them down. So if your child says, you know what? I don't know if I could tell you. Obviously, we want to be that person for our baby. We want to be the one that they come to, the one that makes it better. But we might not be able to. And so if they can't come to us, help them find somebody who they can go to. Maybe that is a coach or a teacher at school or another family member. Just help them figure out who that might be. Provide resources. Maybe they just can't think of any real live adults that they would go to, but they might be willing to call a hotline, or they might be willing to use a text line. Have those numbers and be able to give them to them. Help them formulate a safety plan. So obviously you guys are not all therapists. You're not going to make safety plans in quite the same way we make safety plans in my office, but we are going to talk a little bit about what should be in a safety plan if you have a child who's struggling. Help them identify reasons they have not killed themselves or reasons to stay alive. When someone comes into my office and they tell me they've been struggling with suicide, that they've been thinking about killing themselves, one of the questions I ask is, why haven't you? You're telling me that you think about killing yourself all day, every day. Why haven't you done it yet? And I'm not asking that to challenge them. I'm asking them that question because there must be a reason. And if we can help them figure out what that reason is that they've stayed alive, we might be able to use that reason to help them continue to stay alive. So maybe they're still alive because they know that their death would hurt people that they love. And we can help them build on that love and on that support of that relationship. Or maybe they still have some things that they kind of want to accomplish. Help them look at those future goals and be aware that there might be reasons to stay alive. Restrict access to means of harm and be aware of risks in their environment. When you talk about suicide all day, every day, you can look around a room and spot a dozen ways that someone could die. Fortunately for you guys, you haven't had to have that experience to have that skill, but there are some things that are obvious ways to hurt yourself. And if you're worried about your child, if you're worried about their safety, they've come to you and said, I think about killing myself, you can do some things to help restrict that. So like for Ashley, she'd thought about taking pills. We all have medicine cabinets at home full of pills. And even things that are over-the-counter, things like Tylenol or ibuprofen, can be lethal. If your child's thinking about overdose, they shouldn't have easy access to those. If they're thinking about cutting their wrists, think about all the sharp objects in your house. The kitchen knives, the razor blades, the scissors, the utility knives. Which of those things can you put away and restrict access to? And which of those things do you just need to really closely monitor and know where they are and not leave your child alone with? Things like hanging. What are some things that are really obvious ways to hang yourself, and be aware of them? We can't necessarily get rid of them all, but know. Cleaning products, things that are toxic, just really being aware of the risks that are all around us. And seek professional advice. This isn't something that you guys are equipped to handle all on your own, but there are people who know what to do and know how to help you keep your child safe, and can work through safety plans with you, and can teach you and your child skills to communicate about this, and can help your child learn ways to cope so that it doesn't have to be this bad all the time. And seek a higher level of care if it's needed. If your child comes to you and they say, I'm going to kill myself tonight, and you don't feel like you can come up with a plan that will keep them safe, seek help. Reach out. You can always call 911. That's always an option. They will send somebody out to help make sure that your child stays safe. You can take them to an emergency room and ask for them to be assessed. You can call a psychiatric hospital and see if there's a bed, or take them to that hospital. But if you're just not sure, it's always better to seek more help than not enough. So today in our presentations, all of the students that attended filled out a coping plan. I didn't call it a safety plan because for most of your children, they don't need a safety plan. Most of them are likely not thinking about killing themselves right now. But all of them have times when they struggle and they're overwhelmed and they're stressed out and they need cope. So I have copies of those in the back by our table if anyone wants to see what those looked like. We have extras left over from this morning. Or you can talk to your students about them. Go home and be like, hey, I heard you did this thing. Can I see it? Or can we talk about it? They'll love that. But things that you should think about when you're doing a safety plan. So there's an app called My Game Plan that's really good for safety planning. I sometimes have kids download it on their phone, and it looks at some of these things that we're going to talk about. So helping them think about what their triggers are. What are the things that make you feel this way, so that we can figure out how to either avoid them or plan for them? What are some of your warning signs? How do you know when you're starting to struggle? What does that look like for you to be able to recognize it, and then also for me to recognize it? So if you start crying a lot, or you're saying you're overwhelmed, or you're feeling hopeless, and you're telling me these things, I can know, oh wait, she's probably having a hard time, or he's probably having a hard time. I need to check on them. We want to help them identify ways to cope. What are things you can do to help yourself calm down when maybe you're not at a place where you need me to help you stay safe, but you need to do something or it's going to keep getting worse? So in their small groups, they were supposed to come up with as many of those as they could think of, and then they were supposed to choose some for their coping plan that seemed best for them. They all also got these little cards. We have some on the table out back, but they have a Bible verse on one side, and then on the other side is 20 ways to cope. And they're little, sort of not laminated, but like the thicker material. They fit in a wallet. They're really nice to have. So helping them think of things that work for them. Helping them figure out who they can ask for help. Is it a parent, a teacher, a coach, a family member, but an adult? It's okay to have friends that are support, but we want to make sure there's at least one adult that they can tell, whether it's you or not. And then those reasons to stay alive. Help them think about why they want to stick around. So what shouldn't you do? Because we all want to not make a big mess of this, right? Don't be afraid to ask. Like I talked about before, asking them is not going to put the idea in their head. If it's there, it's already there. And you asking them gives them the opportunity to tell you. Don't assume they're too young to be suicidal. I've had patients as young as 4 who made suicidal statements and did things to hurt themselves. Now, a 4-year-old doesn't fully understand the concept of death, but that doesn't mean they can't kill themselves. None of your children are too young to feel this way. Don't make them feel that their feelings show a lack of faith. It's easy for kids to get the message that if they're struggling, it means it's because they're not trusting God. And that's not the message we ever intend to send, but sometimes it's the one that they hear. Help them know that we understand that they're having a hard time and that there can be legitimate psychological things going on that doesn't mean they don't trust God. Don't dismiss it. If your child says something that makes you uncomfortable or that makes you nervous or comes to you directly, don't blow it off. I've had teenagers whose parents said to them, "Oh, you'll never really do that." And that's it. That was the end of the conversation. Don't minimize their distress. Hear what they're saying. Acknowledge their pain. Don't tell them, "Oh, you're just a teenager. You'll get over it. It's not that bad." Don't offer those meaningless platitudes. "Oh, honey, it's all going to be okay." No, it's not. It doesn't feel like it is. It feels like my world is falling down around me, and if you say to me, "You're going to be okay," you didn't really hear me. You didn't see how much I hurt. Don't challenge them or tell them they would never really do it. I've had parents say, "Well, fine, go kill yourself then." Or say, "No, you're just looking for attention. You're never really going to do that. Just stop." Don't share what they told you with others who don't need to know. You obviously have your own support system, and you might need to tell your best friend because you've got to be okay to help your child. Fine. But that needs to be a friend that's not going to spread it around. You need to be really careful about who you're sharing this information with. So I like this verse because I feel like parenting is really hard, you guys. They don't tell us all of the stuff that's going to happen with our kids. There's no manual that says, like, if this happens, then do exactly this. And each child you have is a little bit different, and so what worked with Bobby's not going to work with Susie. But God's there, and He knows that we're doing the best that we can. And so I feel like this verse is a good reminder. The Lord Himself goes before you and will be with you. He will never leave you nor forsake you. Do not be afraid. Do not be discouraged. Deuteronomy 31:8. Do not be afraid. Do not be discouraged. Parenting is hard, but you guys obviously care about your kids. You're here, and you're learning, and you want to help. And so when you're struggling, you can go back to God and ask for His help, and you can go back to your support systems and say, "I don't know what to do." And maybe that means reaching out to a counselor. If your child's struggling at this level, please let it mean reaching out to a counselor. All right, so these are just some resources. I have a PDF of the PowerPoint. I didn't print them because I didn't know how many people would actually want the PowerPoint. If you want it, if you want to give me an email address afterwards, I can send it to you. It's totally fine. And then these are some hotlines. Your students got a lot of these numbers today as well. And then for the kids, I started with a song that was a little bit intense and talked about suicide and talked about somebody actually ending their life. And it was kind of a lot, but I did it on purpose, just like I started you guys with something that was a little bit intense and a little bit hard to watch, because I want to pull you in and I want you to feel it so that you hear it. So I also ended with a song, and I'm going to end you guys with the same song, but this song's a little bit different because I feel like there's a lot more hope. All right, well, thank you for your time and your attention and for your willingness to talk about such a hard subject. Your kids sat through this for 90 minutes today. They got more of it than you did. I think it's a good place to start conversations, but they might be a little burnt out on it by the end of today. So be gentle. And we'll be around. I'm here and my team is here if people have questions or things they want to talk about before you leave tonight. Thanks, guys.